Measles. Once nearly eradicated, it's making a comeback, alarming global health experts. Waning herd immunity, fueled by vaccine hesitancy and misinformation, has weakened our defenses. Global travel can quickly transport the virus across borders, creating outbreaks. Measles is a serious disease, especially for young children, pregnant women, and those with compromised immune systems. The World Health Organization has declared vaccine hesitancy a top global health threat. This hesitancy, rooted in misinformation, creates pockets of vulnerability. In our interconnected world, an outbreak anywhere can become a global concern. Strengthening vaccination coverage and combating misinformation are crucial. This fight requires the engagement of individuals, communities, and societies worldwide. Measles. It's a serious infectious disease caused by the measles virus, part of the paramyxovirus family. The virus targets cells in the respiratory tract, spreading rapidly through the bloodstream. This systemic invasion makes measles dangerous, affecting multiple organ systems. It's not just a childhood rash, it's a formidable foe. Measles is highly contagious, spreading through the air with remarkable efficiency. Viral particles can linger in the air for up to 2 hours. It also spreads through direct contact with infected mucus or saliva. Sharing utensils or kissing can transmit the virus. The virus can survive on surfaces for up to 2 hours, posing an indirect threat. The measles virus spreads silently before symptoms appear. An infected person can be contagious for up to 4 days before the rash emerges. Imagine a child unknowingly spreading the virus at school. This chain of transmission can continue rapidly, especially in low vaccination areas. Measles outbreaks can quickly spiral out of control. Global travel facilitates the rapid spread of infectious diseases like measles. A traveler can unknowingly carry the virus across borders. This is concerning in countries with high vaccination rates. Travelers can introduce the virus to their communities, sparking outbreaks. Controlling measles requires global effort, prioritizing vaccination and rapid response. Measles' early symptoms mimic a common cold or flu, leading to misdiagnosis. Initial symptoms include fever, irritability, red eyes, and a persistent cough. Koplik spots, tiny white spots inside the mouth, are a crucial clue. These symptoms are a prelude to a more dangerous phase. Misdiagnosis delays treatment, allowing the virus to spread unchecked. Three to 5 days after initial symptoms, the measles rash typically appears. The rash starts on the face and spreads rapidly over the entire body. It's a clear sign of the immune system fighting back. The rash can cover the entire body, causing significant discomfort. The virus's presence becomes unmistakable and very evident. Measles can lead to serious complications like pneumonia and encephalitis. Pneumonia inflames the air sacs in the lungs, making breathing difficult. Encephalitis, brain inflammation, can cause seizures and brain damage. Measles weakens the immune system, making the body vulnerable to other infections. In rare cases, it can lead to fatal degenerative brain disorders like SSPE. Certain populations are particularly vulnerable to severe measles complications. Infants and young children are at increased risk due to their developing immune systems. Pregnant women face risks like miscarriage and premature birth. People with weakened immune systems are more susceptible to severe illness. Early vaccination is crucial to protect these vulnerable groups. Infants under 1 year are particularly vulnerable to measles. Their immune systems are not mature enough to fight off the virus. Measles can lead to severe complications like pneumonia and encephalitis. The MMR vaccine provides lifelong protection but is given at 12 months. Infants are vulnerable during their first months of life. Measles can infect anyone regardless of age. Pregnant women face unique risks, including miscarriage and birth defects. Infants born to mothers with measles are at risk of congenital measles syndrome. The fear and uncertainty of a measles diagnosis during pregnancy are immense. Measles is not a disease to be taken lightly. Vaccination is our most powerful ally against measles. The MMR vaccine provides safe, effective, and long-lasting protection. The first dose is given between 12 and 15 months with a booster at 4 to 6 years. The vaccine triggers the immune system to produce antibodies. These antibodies provide a memory of the virus, preventing future infections. Beyond vaccination, we must employ a multi-pronged approach to prevent measles. Good hygiene practices reduce the spread of infectious diseases. Regular hand washing and covering coughs and sneezes are effective measures. Disinfecting frequently touched surfaces can further reduce transmission. These practices, combined with vaccination, create a strong defense against measles. Section 3. When measles strikes, containing the contagion. Despite our best efforts, measles outbreaks can still occur, especially in communities with low vaccination rates or in the face of international travel. When measles strikes, swift and decisive action is crucial to contain the outbreak and prevent further spread. This involves a combination of isolation, contact tracing, and targeted vaccination efforts. Isolation, one of the oldest and most effective public health measures, involves separating infected individuals from healthy individuals to prevent the spread of the virus. People with measles are most contagious during the 4 days before the rash appears and for 4 days after the rash appears. During this period, it's crucial to stay home from school, work, and public places to avoid spreading the virus to others. Contact tracing, another essential tool in outbreak control, involves identifying and monitoring individuals who may have been exposed to measles. This is typically done by interviewing the infected person to determine who they have been in close contact with during their contagious period. Recognizing the enemy early detection is key. Measles is a chameleon, its early symptoms often mistaken for those of a common cold or flu, making it a master of disguise. This mimicry can be dangerously deceptive, leading to delayed diagnosis and treatment and allowing the virus to spread unchecked, affecting more children. The first signs of measles are subtle: a fever that can climb to alarming heights, reaching 104 degrees Fahrenheit or higher, accompanied by a general feeling of malaise and discomfort. The child might be unusually fussy, their eyes red-rimmed and watery, as if they've been crying for hours. A persistent cough develops, adding to the illusion of a harmless cold, along with a runny nose that seems to flow endlessly, making it hard to distinguish. But there's a telltale sign, a harbinger of the storm to come, often hidden in plain sight: Koplik spots, which are crucial for early detection. These tiny white spots, resembling grains of salt sprinkled on inflamed tissue, appear inside the mouth, often on the inner lining of the cheeks, and are a key indicator. They are a hallmark of measles, a crucial clue that distinguishes it from other respiratory illnesses, making them vital for diagnosis. Unfortunately, Koplik spots are often overlooked, especially in the early stages, as they can be faint and easily missed without a close examination, leading to misdiagnosis. Parents, already sleep-deprived and worried, might dismiss them as harmless, attributing them to teething or a mild irritation, not realizing the severity. As the virus gains a foothold, the fever intensifies, and the child's discomfort grows, making it clear that something more serious is at play. The cough worsens, sometimes accompanied by a hoarse voice, as if their throat has been scraped raw, adding to the child's misery. The once bright eyes become increasingly sensitive to light, making it painful for the child to look directly at light sources, causing them to seek darkness. They might turn away from lamps, bury their face in their parents' shoulders, seeking solace in the darkness, trying to escape the pain. These initial symptoms, though seemingly innocuous, are a prelude to a more dramatic and potentially dangerous phase, underscoring the importance of early detection. Seeking help, navigating the healthcare maze. Suspecting measles is the first step in a journey that can be fraught with anxiety and uncertainty. It's a journey that often involves navigating the healthcare maze, a labyrinth of phone calls, appointments, and waiting rooms. The first and most crucial step is to contact your healthcare provider. However, it's essential to do so with caution, as a trip to the doctor's office or emergency room could inadvertently expose others to the highly contagious virus. Before heading out, call ahead and inform them of your concerns. mentioning the possibility of measles. This allows the healthcare team to take appropriate precautions to prevent the spread of the virus within their facility. They might advise you to come in at a specific time when the waiting room is less crowded, or they might direct you to a designated isolation room to minimize contact with other patients. Once you arrive, be prepared to provide a detailed history of your or your child's symptoms, including the onset and progression of the fever, cough, runny nose, and any other unusual observations. Be sure to mention any recent travel, especially to areas with known measles outbreaks, or contact with individuals who have recently traveled to such areas. The doctor will perform a physical exam, carefully examining the skin for signs of the characteristic rash, and looking inside the mouth for Koplik spots. If measles is suspected, they might order a blood test to confirm the diagnosis. The blood test looks for the presence of measles-specific antibodies, proteins produced by the immune system in response to the virus. This step is crucial for an accurate diagnosis and to ensure appropriate treatment. A collective responsibility. As we've journeyed through the world of measles from its microscopic origins to its global impact, one message rings clear. This is not just a disease of the past, a relic of a bygone era. Measles is a present danger, a stark reminder that in our interconnected world, infectious diseases respect no borders, no socioeconomic status, no age. It's a threat that demands our attention, our vigilance, and our collective action. The resurgence of measles, fueled by vaccine hesitancy, misinformation, and disparities in healthcare access, is a wake-up call, a stark reminder that the progress we've made in combating infectious diseases is not guaranteed. It's a call to action, urging us to renew our commitment to vaccination, to combat misinformation with evidence-based knowledge, and to advocate for equitable access to healthcare for all. The fight against measles is a marathon, not a sprint. It requires sustained effort, collaboration across borders, and a shared understanding that our health is interconnected. Every parent who chooses to vaccinate their child, every healthcare worker who combats misinformation, every individual who advocates for public health measures, they are all contributing to a healthier, safer future. Knowledge, as they say, is power. By understanding measles, its modes of transmission, its symptoms, and its potential complications, we empower ourselves to make informed decisions about our health and the health of our loved ones. We can recognize the early warning signs, seek timely medical attention, and take steps to prevent the virus's spread. But knowledge without action is like a seed unplanted. It holds potential but cannot flourish. Prevention, the cornerstone of public health, is our most powerful weapon against measles. Vaccination, the single most effective way to prevent measles, is a gift, a legacy we can pass on to future generations. By choosing to vaccinate ourselves and our children, we are not only protecting ourselves but also contributing to the collective immunity of our communities, safeguarding those who are most vulnerable. Beyond vaccination, simple yet effective hygiene practices, frequent hand washing, covering coughs and sneezes, and disinfecting surfaces can significantly reduce the spread of the measles virus. And when traveling, especially to areas with known measles outbreaks, it's crucial to stay informed about travel advisories, take necessary precautions, and seek immediate medical attention if any symptoms develop. Remember, the fight against measles is a shared responsibility. By staying informed, getting vaccinated, practicing good hygiene, and advocating for public health measures, we can create a world where measles is a distant memory, a relic of a time when infectious diseases held sway. Let's work together to build a future where every child, every individual, can live a long, healthy, and measles-free life. A future where our collective efforts have eradicated this preventable disease. Knowledge is key. Please remember to like, share, and subscribe.